Hello, my name is Marom Bikson, and I'm excited to present to you today about high-definition transcranial electrical stimulation, or HD-tES, and its unique potential for the treatment of a variety of brain disorders. These are my disclosures. Okay, so there are many forms of neuromodulation, also called brain stimulation. But what they all share in common is that they all deliver energy into the body in order to change nervous system function. And there are different types of brain stimulation or neuromodulation techniques. Some require surgery and they're implants. Some are either so expensive or associated with complexity that requires trained staff or risk that they're very hospital-based. And some are battery-powered and wearable. And so these are the examples of you might be familiar with as far as implanted techniques. The name usually tells you how the device is delivering energy into the body. So for example, deep brain stimulation implants electrodes deep in the brain to stimulate deep nuclei. Now, there are non-invasive techniques that are nonetheless hospital-based. Electroconvulsive therapy is used for depression, transcranial TMS, and a variety of ultrasound-based techniques. And finally, you have in this final category the wearables. These are typically battery-powered devices, and they include transcranial electrical stimulation. A subtype of that is transcranial direct current stimulation, or TDCS, and there are other techniques as well. I'm going to be talking about focusing on TES today. Now, it's often understood that as you move from this direction to this direction, you are willing to accept more risk with your intervention. So obviously, surgical-based interventions have a level of risk right there associated with it. But also these techniques, for example, TMS, as used to treat depression, has a low risk of seizure, whereas these techniques here would be considered the lowest level of risk. But then at the same time, there's also a notion, which I will be challenging, that as you move from this side to this side, you also achieve more targeting. So the one justification for doing an implant, and sometimes this justification, to be clear, does exist, is that you can target a specific brain region in a more focal way. And finally, and this I'm certainly going to challenge, is the notion as you move from this way to this way, you have more effective technology, meaning that everything here is going to be more effective than this, and everything here is going to be more effective to this. And I'm going to be showing you and hopefully convincing you today that that is certainly not the case at all. I think that there are going to be technologies in this category, right, that can be, while low risk, targeted, and very effective. And of course, the technology that I'm going to be talking about is high definition transcranial electrical stimulation, or HD-tES. To understand HD-tES, you just need to understand the two inventions that made HD-tES possible. The first one was the high definition electrodes themselves. So these are small cups, they're gel filled with a wire inside, and these were engineered to allow you to deliver current through the head, through the scalp, with a small surface area, but in a way that was safe, does not damage the skin, and was not painful. So high definition TES, or high definition TDCS, the high definition refers to the electrode. The second innovation that made high definition TES possible was modeling software. And this modeling software starts with identifying a brain target, and then the software tells you where you put these electrodes on the head and how much current you put into each one in order to reach that target specifically. Now, in order to create this software, we also had to develop the first pipeline for full head current flow modeling or neuromodulation modeling. I'll be talking about more about that, but this was a You cannot do these models if you do not have a pipeline to model the entire head during stimulation. And in fact, this optimization, this modeling software, you can learn more about it in these papers. I do want to talk a little bit more about this study right here. Now, before I introduce high definition TES, let's talk about regular TES, or what I'm going to call conventional TES. And so this is what a conventional TES system looks like. You have your stimulator here, you have the wires, and the wires are going to the head. And I want you to notice that there are two wires. Two wires really means one channel, okay? And the current is traveling down the wires to the electrodes on the head and then through the subject's head. So the key thing to understand here is that with conventional TES or tDCS, you just have one channel, two wires, and you have just two electrodes on the head. And notice that those electrodes are rather big. They're often 5 by 5 or 5 by 7 centimeter square pads. Okay, so going back to the modeling, what we did is we predicted in a computer simulation where does the energy flow go into the brain during tDCS. But in order to do that, again, we had to create the first MRI-derived, the first what we called gyri-precise models of the head, where things like CSF, the folding of the gyri, were all preserved, as well as details of the skull anatomy and so on. We modeled conventional TES or tDCS, and what that means is, again, that there were these two large electrodes, and I want to emphasize really that in order to do this, we really had to develop these first pipelines for current flow. Now, I'm going to be showing you results using these sort of false color representations, where a hotter color means that it is a brain region where it is getting current flow, whereas a very cold color is an area that is being spared. And so this is the kind of result that we see. Let's zoom in on that a little bit. You can see here that the current is flowing from one electrode to the other, and you're seeing that a lot of the brain is being stimulated, really the whole region between these sort of large electrodes. So this is what you get with conventional tDCS or TES. You have some control over where the current flows, but it is not a targeted form of stimulation. Okay, now I want to compare that with what you can do with high definition TES. And so what we did in this paper is we invented a montage of high definition TES. So we're starting with the high definition electrodes. That's why they're small, but how many and where do you put them? So we came up with the 4x1 montage, where you have one center electrode. You can think of that as your active, and then there are 4 collector electrodes surrounding it. So that's what you're seeing in that simulation here. And this is the prediction of brain current flow under high definition TES. Let's compare that with conventional TES and what it looks like. So what you can see here is that with high definition TES, using this 4x1 montage, you can deliver current in a targeted way to the cortex. So the reason conventional is not targeted is not something specific about electricity or something inherent to the head shape or the skull. It's just because you were using two large electrodes. And when you went to smaller high definition electrodes and arranged them in particular arrays, you were able to produce more targeted outcomes. So this is non-invasive, still low intensity stimulation, but it is targeted. Okay, so we have high definition TES, or analogously, high definition transcranial direct current stimulation. And I want to discuss what are its special and beneficial features. So the first one, which I'm hopefully just explained to you, is that you can deliver focal stimulation to any brain region just by moving these electrodes around. Now, I showed you an example of 4 electrodes. There are high definition deployments with just 2. They're right next to each other, all the way up to over 100 channels. Now, again, when you're talking about 100 channels, you're really going to be relying on software to help you figure out where those electrodes should go and how much current you should put in. And so this is really what a modern high definition system would look like. You have to start with your headgear, and here are your high definition electrodes. They're being driven by a multi-channel high definition stimulator, but how to program that high definition stimulator is being determined by the high definition modeling software. Now, while this is increasingly sophisticated, this technology remains low power. It remains battery powered, and for that reason, it maintains all the benefits of conventional TS or TS as far as tolerability. High definition is considered a minimal risk intervention. It's used not just on patients, but also on healthy subjects as well. And it can be made portable. This is an example of a portable system right here, where you can see the different high definition electrodes. And here you have the stimulation unit itself. Another really important advantage of high definition TS that is really almost unique in the spectrum of brain stimulation techniques is the ability to deliver an arbitrary waveform. So you can deliver direct current or sinusoidal current or pulses or stimulation or really anything you want, and that's what's shown here. You can't do direct current with an invasive technique, you can't do direct current with ultrasound, you can't do direct current with TMS, but you can do it very easily with high definition. Or you can very easily apply a pure sinusoidal stimulation, which would be impractical or impossible with many other techniques as well, of any frequency you want, or even multiple frequencies, right? You can do noise, you can do pulses, in fact, arbitrary pulses. You can change their frequency, their shape. You can do multiple pulses, you can do indifferential. All that is made readily possible by high definition TES. So these are the unique features, and what I want to show you next is how these unique features lead to very unique and very exciting outcomes. Okay. So I want to start by taking a step back and explaining why the ability to stimulate with pure sinusoids is of special interest. And this is something that has been reviewed here, and it's also been reviewed elsewhere. The basic idea is this. You start with the brain activity that you want. It's a desired behavior, it's a desired state. And you assume that that behavior, right, is associated with a particular type of brain activity, and you measure it using something like EEG or some electrophysiological measure. And so what you're seeing here, right, is the electrophysiological equipment, and this is an example of maybe a type of oscillation that you would see that the brain is generating. So the oscillation marks the brain activity, which marks the behavior or state that you wanted. And once you have that oscillation, you can analyze that oscillation, and you can determine, for example, whether it has a characteristic or dominant frequency, 1 hertz, 10 hertz, 60 hertz, and so on. Now imagine that you create a sinusoid, and the sinusoid has the same frequency as the endogenous oscillation. Now, it doesn't look exactly the same, but it has that same characteristic oscillation frequency. So let's say if the oscillation frequency was at 10 hertz as its dominant frequency, we generate a 10 hertz sinusoid. That 10 hertz sinusoid is used to drive a stimulator, such as a high definition TS stimulator, in order to deliver the stimulation to the brain and to try to change brain activity. And what are we hoping for? We're hoping to influence this very same oscillation, and therefore to shift the brain towards a desired state, and therefore to produce the desired behavior. So for example, if we found that the behavior is marked by 60 hertz oscillations, perhaps you would stimulate at 60 hertz. Now, of course, it's a little bit more sophisticated than that. Nothing with the brain is so simple. It's not always about boosting the oscillation. Sometimes you are entraining it, so making sure that its phase is more reliably locked to what you're putting in. You can also sort of amplitude modulate oscillations, so it's a rich space. But the thing I want to emphasize here is the particular cleanliness and value of being able to use sinusoidal stimulation, because how analogous it is to the brain's own endogenous activity. Okay, so how does this unique capability lead to unique outcomes? So I want to summarize really what is an exciting series of papers by Dr. Reinhardt, who is in Boston University in the city of Boston in the United States. And what he was very interested in was enhancing brain function, recall memory in older adults. And the approach that he used was high definition transcranial alternating current stimulation. He identified several brain regions of interest and several frequencies of interest, and he, using high definition tACS, designed a very customized intervention. So that intervention was applying stimulation at a frequency that was tuned to the individual's brain oscillation frequency and was tuned at a population level to regions that he identified as very important in the function that he was interested in. And this was dual target. So just like you can use high definition to target one brain region, here you're using high definition to target multiple brain regions at the same time. So what Dr. Reinhardt and his team was able to do was, in a very elegant way, stimulate specific brain regions with specific oscillations in a manner that he hypothesized would be able to enhance memory. And this was only possible because the technology that he was using made it possible. I'll refer you to the full paper in more detail, but the short of it is, in control conditions, so at the start of the experiment, the older adults performed less well than the young people, but after applying stimulation, and again, it's important in a very specific way. That's what he showed in the paper. It has to be done in a very specific way using high definition TES. He was able to restore function in the older adults so that they were able to compete with the younger individuals. And again, to emphasize really the outcomes, in fact, the entire experimental design would have been impossible without high definition tACS. Okay, changing gears a little bit, I want to talk about transcranial magnetic stimulation, or TMS. TMS remains today the most studied and I think used form of brain stimulation, certainly non-invasive brain stimulation. Here you have the TMS coil. One of the reasons people are excited or interested in TMS is, on the one hand, it is non-invasive. On the other hand, it is targeted. That's why they're using, for example, this neuronavigation system to target a very specific brain region. It has been established in clinical trials and approved across multiple regulatory agencies, including the United States FDA, for the treatment of different disorders. This sort of summarizes the development of technology for those different disorders, including refractory depression, pain, migraines, OCD, addiction, anxiety, and so on. And I think these indications will continue to expand, but these are clinic-based systems. They're both costly, they require expert operators, and there is a small but real risk of seizures. So it's not a minimally risk technology. And so the question, of course, we can ask is, well, what if we could invent a technology? I mean, I'm talking about high definition TES, right? That could be non-invasive also, targeted also, but lower intensity in a way that you didn't have these risks of seizures, you didn't have these associated costs, maybe even you can use it at home, and would it be equally therapeutic, right? That's the question. Would you lose therapeutic efficacy by making it targeted and non-invasive? Okay, so the first thing to understand is that if you look at optimized high definition TES or high definition tDCS, it is not less targeted than TMS. Now, how do we know that? Different lines of evidence, including this paper here. So the first thing to draw your attention to, this is a computational model. This is a current flow model. And what you're seeing here is different brain regions being targeted. So going from the interior to posterior parts of the head, we are stimulating different brain regions. And look at where the intensity of the colors are, right? It's restricted to the areas that we want to stimulate. It is blue everywhere else. So this level of transcranial focality shown by modeling is not that different than what you would get with transcranial magnetic stimulation. We took it a step further in this paper, and we actually looked at a measure of human neurophysiology. I'll refer you to the paper for the full details, but the bottom line is, at the level of resolution that we looked at this paper, we could not distinguish between the focality of transcranial magnetic stimulation or the focality of high definition TES. They were equally focal. TMS is not more targeted than optimized forms of high definition TES. But I do want to clarify, TMS is more targeted than conventional TDCS, right? So that's what you're seeing here. If you use conventional TDCS with 2 large electrodes, TMS is more targeted in that sense. Now, another big difference between TMS and transcranial electrical stimulation is that TMS depends on these brief, high-intensity pulses applied in a train, right? Tat, 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 tat. That is the inherent to the TMS technology, whereas TES is can be a more sustained, low-intensity form of stimulation. And so then the question comes up, well, if we were to apply less intense stimulation, not the high intensity of TMS, but the low intensity of TES, or high definition TES, would it necessarily be less effective? Well, talking about just regular TDCS, the answer is not necessarily. So there have been multiple randomized controlled trials and ultimately meta-analyses and reviews of conventional TDCS for depression, showing that it is certainly effective, including in patients who are refractory to drugs. Now, the nominal, which means sort of in principle, target of conventional TDCS is the same as TMS. In both cases, the target is this small brain region, the left dorsolateral prefrontal cortex, or DLPFC. But let's look at the current flow model of this conventional TDCS montage. It produces current flow through much of the front of the brain. So that's what you're seeing here in red, whereas green is in this case where you have no current flow. Now, here is the left DLPFC. It is stimulated by this montage, but it is not targeted by this montage, right? So both TMS and regular TDCS are getting to this montage, but regular TDCS is not getting to it in a targeted way. So of course the question is, what if we did high definition TDCS targeted to the DLPFC? Would it be effective? Well, a team in the United States, led by Dr. Nahr and colleagues, did exactly that. They ran a trial of high definition TDCS, looking at its ability to treat depression. Again, they used a form of high definition TDCS that is low intensity, direct current, but targeted to the left DLPFC. Just 12 days of treatment. The side effects were minor, just like regular TDCS, itching, redness, and they report a significant improvement in mood. And again, according to their own words, the effect sizes that they were seeing were similar to drug therapy, right? And their point was, and this was just 12 days. So their point was, not only is this an exciting treatment, right? But it's also potentially a very fast-acting treatment. And my goal here is not to go into all the clinical details of the paper, but rather to continue to try to convince you that just because you are targeted and low intensity does not mean that you are less effective. It simply doesn't translate that way at all. Okay. And we can address the same question more mechanistically using clinical neurophysiology. So this was a paper led by Michael Nietzsche, who was the co-originator of conventional TDCS, and here we are comparing cortical plasticity induced by conventional TDCS with high definition TDCS. Now, a standard way to measure cortical excitability or plasticity is by using transcranial magnetic stimulation, motor evoked responses, or TMS MEPs. In this case, TMS is not being used as a neuromodulator, it's just being used as an assessment. You measure brain activity at baseline using TMS MEPs, then you apply tDCS or high definition TDCS, and then you look at the changes in excitability afterward. So these are the results that they reported, again, comparing conventional TDCS with high definition tDCS. This is immediately after TDCS. Both conventional TDCS and high definition TDCS produced a significant change, perhaps higher initially for conventional TDCS. But whereas the conventional TDCS effects were no longer significant, these are no longer significant about 60-30 minutes with high definition TDCS, there seemed to be a boosting of effects over time. And this is after stimulation, peaking at around 60 minutes with a peak that was higher than conventional TDCS. And in fact, 2 hours later, this was still significant, right? They had to go out to 6 hours to ensure that the excitability returned to baseline. And perhaps what I didn't mention was that this stimulation was only 10 minutes. So not even that intense. 10 minutes of conventional high definition TDCS produced over 2 hours of changes in brain excitability. And those changes were in peak amplitude and in duration larger than conventional tDCS, right? So again, it is simply not the case that becoming more focal makes you less potent. I showed you before all these advantages, right, of high definition TS, including the ability to use a variety of low intensity arbitrary waveforms. I want to mention yet another benefit, which is the ability to be able to combine high definition TS with different forms of brain imaging, and specifically non-invasive brain monitoring using EEG or FNIRS. And the reason this is so readily possible has a lot to do with the mechanical integration. So you can see here we have a FNIRS and an EEG system seamlessly, I would say, integrated with high definition TDCS. Here you have your high definition TS electrodes, and then here you have your EEG electrodes. So they're interlaced. And in fact, you can even use the same electrodes, and you can see the same kind of interlacing for the FNIRS system. And the ability to combine this really leads to many experimental and clinical directions that would be very exciting, such as, again, mapping individual brain activity and stimulating, and this notion of also closed loop stimulation. So these systems now are enabled for real-time closed loop stimulation. So you can imagine you are recording your brain activity, you are processing it, and then you are stimulating, and then recording the brain's response. And so all this is readily, technically possible now with high definition TES. And moreover, there's this very interesting idea that you can actually record from a brain region and then using a very straightforward algorithm, stimulate that same brain region. So let me explain what I mean by that. I'll explain it here in sort of a cartoon form. All the details are in this paper. So you start with some sort of task, some sort of behavior that produces a desired brain activity in the brain, activates a particular region of interest. And then you use an EEG system, right, to record that activity. We have developed a closed form algorithm. You do need the subject's MRI. Once you run that algorithm, that software tells you where to put the electrodes and how much current to put in them in order to stimulate that same brain region. Now, I told you before about recording a frequency and then stimulating back with the same frequency, right? That's still there, that's in time. But now I'm telling you, you can also combine that with doing it in space, where you can record a brain activity and then go back to that same brain region. Again, using these sort of, whether it's offline or closed form, high definition systems. Okay, I want to now transition to talk a little bit about some clinical indications, and I'm just picking these to try to illustrate the flexibility and different utility of high definition TS. I want to talk about high definition TS for COVID and refer you to this paper. This was a complex international collaboration that was run around the peak of the COVID-19 pandemic. And this was trying to stimulate critically ill patients. These are patients in the ICU, and these are patients on ventilators. And so the system had to be brought to the patients. So that's what you're seeing here. This is a portable battery-powered stimulator. The patient is on a ventilator. You can see here a customized high-definition headgear, 4x1, 4 with 1 in the middle. Here are the wires running to the stimulator. This could be brought to the patient's bedside, which was very important. And moreover, it could be done in a way that did not interfere with the other standard of care and, of course, the ventilation that this patient was receiving. And the 4x1 high-definition TDCS was optimized to stimulate the diaphragmatic motor cortex, again, in a portable way. I'll refer you to the paper for complete details, but here's the paper's results. As reported, high-definition TDCS got people off ventilators faster. And getting people off ventilators faster has profound significance for both their short-term and their long-term health. All right? Getting them off the ventilators faster means less delirium, less organ failure, less death. And high-definition TDCS was able to do that. And it is I think, a dramatic example of how just because you are non-invasive and low intensity does not mean that you are not effective, right? This is a profoundly effective intervention in a very challenging environment. Now, high definition TDCS has also been used for long COVID. So these are patients who had COVID and who continue to be symptomatic for many months or even years afterward. Long COVID, or PASC, as it's referred to, another international collaboration. Here, again, using high definition TDCS to the motor cortex, just 10 sessions, and this was combined with rehabilitation. I want to refer you to these papers for the complete details, but one of the lessons that this taught us and that I want to convey to you is that you have high definition TS that can be targeted to a particular brain region and moreover with a particular waveform. So that's one form of control. It's also very important to think about patient inclusion. For example, in this case, we realized that just because a patient with long COVID reports fatigue, the fatigue may have more than one source, right? It could be neurological, it could be something else. And so patient selection is very important. And the final piece of it is what rehabilitation or other therapy you combine high definition TDCS with. So these are really the three elements. And this trial, I think, was very successful only because those three elements were chosen well. And I think if they were not chosen well, it would have been less successful. And the results were very encouraging. Again, and this is a patient population that doesn't really have a lot of options. Okay, changing gears a little bit and now talking about pain. And this is a lot of work that was really led by Dr. De Silva, also in the United States. Dr. De Silva developed a montage, a high definition montage, in order to try to treat different forms of pain. Now this is a 2x2 montage. What that means is that on each side of the head, you have 2 and then 4 electrodes altogether, but a 2x2 montage. And this montage specifically targets the motor cortex. It can be done unilaterally. It can also be done, as shown here, bilaterally. So yet another example of multi-target, high-definition TES. Now, Dr. De Silva was actually inspired by invasive stimulation. Motor cortex stimulation is an invasive technique where an electrode is implanted inside the subject at or near their motor cortex, and it's been trialed for a long time for different forms of pain. And his idea was simply, let's do that non-invasively. Instead of inserting an electrode, let's go to the outside. And I will refer you to this publication and others. I think the results were very encouraging. These are very difficult to treat patients, often very refractory, and he was able to produce very strong results, and that work continues. And again, it's to drive home at this point. Just because you're non-invasive, just because you're low intensity, does not mean you're less effective. My group has also been working with Dr. De Silva to come up with a more home-based version of this motor cortex uni or bilateral approach, because again, one of the advantages of high definition TES is that it remains battery powered and minimal risk, so you can go home. This is another very exciting effort led by Benjamin Hampstead and his team about taking high definition TES or high definition tDCS and going home with it. This is the invention. You start with a subject-specific MRI, and you use the MRI for two things. The first thing you use the MRI for is to use software to design a customized electrode montage to stimulate brain regions that are relevant for that particular patient. Now, these would be different. You see, in this example, it is a focal montage, right, stimulating one part of the head, and here you have a multi-target montage. So each patient will be prescribed a unique montage. The second thing you use the MRI for is specifically looking at the scalp and using that to render and then 3D print a customized headgear. Now that headgear holds the HD electrodes according to the software prescription. And then that headgear is provided to the patient, and this has been successfully used for even some long-term, home-based, high-definition tDCS. Okay, so to wrap up, I've tried to explain to you why I am enthusiastic about high-definition transcranial electrical stimulation, HD-tES, for a variety of brain disorders. And the point is, it's not a competition, right? It's not a race. You have multiple forms of brain stimulation, and for me, they're all exciting, and they all offer unique advantages. High definition TES, or high definition tDCS, has some special advantages, and what I've tried to show you is, I believe, how those technological advances translate into sort of compelling use cases. So what are those advantages, right? To review finally, focal stimulation of any superficial cortical brain region, right? It's not just TMS. You can be focal with low intensity electrical stimulation, and in fact, you can stimulate multiple targets, and you can optimize for brain targets. This is using the same software. A very special feature is this ability to use arbitrary waveforms. So direct current, which would be impossible with other techniques, a sinusoidal stimulation, trying to match the brain's own oscillations, but really a broad other spectrum of pulses and noise can be used while maintaining all these other benefits and maintaining the benefit of being battery powered, minimal risk. The side effects, again, itching, tingling, skin redness that resolves itself, I think all make for a very compelling use case. And as I keep emphasizing, just because you have limited side effects does not mean you're less effective. That's not the right way to think about it. You can integrate this technology with different forms of brain monitoring. I did mention you can do MRI, you can do other things, but especially non-invasive wearable brain monitoring, such as EEG, I think is really exciting. And the biggest point that I tried to convey here today is that these unique technical features support some very exciting experiments and some very unique clinical directions. So that is high definition TES for brain disorders. Finally, I want to please advertise to you and welcome you to the 2026 NYC Neuromodulation Conference held in New York City. This will be the largest international conference of its kind, spanning all forms of neuromodulation and brain-computer interfaces. It will be held from July 31st to August 2, 2026 at my university in New York City. Abstract submission is now open as well as registration. I invite you and I please hope to see you